I am so excited to have you guys here with me today. My name is Dr. Allison Felt, and I am owner of Body Motion Physical Therapy located in downtown Edmonds. And we are a specialty clinic specializing in the pelvic floor. And we are pelvic expert physical therapists, really helping people live their best lives, prepare for pregnancy, help with fertility, and recover after babies. And then also at any stage in the game. So whether um, you're having painful intercourse, or maybe you've been through a lot of hip pain in your past, and nothing's really helped it, the pelvic floor can be a cause of that. So we're going to go over a lot of that stuff today, and I'm super excited to have you here. Sorry about that. So we will start with what the pelvic floor is. Then we'll talk about really how to know if you have a healthy one. And we're going to go through some tips to improve the health of your pelvic floor. And then also when it would be necessary for you to really seek out a pelvic floor assessment and evaluation. So for attending this webinar, everyone will get a free complimentary discovery visit, which is a visit with one of our doctors if you're interested in exploring more of your own story and what is happening with your own body and anatomy. If you have questions through this, I would love for you to pop it in the chat, and you can go ahead and do that whenever you have a question and something comes up for you. So the pelvic floor, have you guys heard of it? You can type yes into the chat if you want. It'll be fun for me to know what your base knowledge is. So this is a pelvic floor. And so our pelvis is what is located between your low back and your hip joints. And the pelvic floor itself has 3 holes in it. It has the anus, where we have bowel movements and poop from. It has the vagina for intercourse and also to deliver a baby. And then it has the urethra. And the urethra is for urine, right? So we can all pee and get rid of urine. Then there's also the clitoris, which is a really important part of the pelvic floor. So that is what is encompassed in the pelvic floor. Now, the pelvic floor has 3 different layers. So this is the first layer, and then there's a second layer that is not shown here, and then there's a third deep layer, which if I take out my organs that sit in the pelvic bowl, you can see the third layer. So it's really cool to learn how to use all 3 layers of your pelvic floor. And this is not just by doing Kegels. So Kegels are a really popular method, right, to strengthen your pelvic floor or strengthen your core. And I'll be completely honest with you, what we see most often is most women especially walk around with their pelvic floors already fully contracted and don't know how to relax their pelvic floors. So a strong pelvic floor is a pelvic floor that can relax, can bulge to have a bowel movement or to fart, and then or to have a baby, and then can fully contract. Like say when you jump or you sneeze, you would want it to contract. So those are the movements of the pelvic floor. The first layer starts to contract first, and then goes the second and third layers. However, that very rarely happens in most people. So most people walk around in this contracted state. That's why if you try to do a Kegel, you might not be able to. So you might feel yourself like trying to squeeze something, squeeze your anus, close your vagina, or you can think about it as move your clitoris. Those are often cues to contract the pelvic floor. But most of the time people have a hard time contracting the pelvic floor because they're already living in that contracted state. So they don't actually feel anything happening further. So what we teach and what you should learn and what I hope you get today is really how to relax your pelvic floor. And even if you prescribe to the Kegel diet and Kegel cultures, which I don't believe in, you don't need to do 100 Kegels a day to have a strong pelvic floor. But as long as you can learn how to relax it, then you know that your contractions will be strong. Cool. Questions yet? So I'm going to just back up a little bit and talk about the rest of the core. So the pelvic floor is a really essential part of the core. And then we'll talk about some of the issues that arise from pelvic floor problems. But it's really important for me to talk about an example by a famous physical therapist. Her name was Mary Massery, or is Mary Massery. She's still alive. And she talks about the core as a soda pop can. Okay. The bottom of the core is the pelvic floor. The front is your abdominal wall and what we call the transverse abdominis. The back are these back muscles and some of your butt muscles as well. And then the top is your diaphragm. So this is what makes a strong core. So it's a combination, not just of your pelvic floor, not just of your abs, not just of your back muscles, and not just of your diaphragm. It has to be integrated. It has to be a combination of all of these muscles working together for you to have a healthy pelvic floor and to have a healthy core. So the reason this is so important is because so many people have trouble in this area. And when you have any problem in the core, say you have weaker abs or your pelvic floor is really tight, I hardly ever see pelvic floor weakness. So that just doesn't happen that frequently. But say if it did, that could be another issue that would affect the pressure inside the can. So if you think of the core as this really strong pressure system, like a pop can, you can't squish this pop can. So no matter how hard you try, this soda pop can is rock solid and you cannot squish it. And that's what a strong core is. So if you're running, jumping, playing with your kids, if you have this solid core, then you're going to be protecting your hips, your knees, your feet, your back, because the core absorbs the forces. However, if this is really weak, then your hips absorb the forces, or your knees absorb the forces, or your back absorbs the forces, and not the core muscles. So having a weak core, having a weak pelvic floor can cause, I said weak, but really it's a really tight pelvic floor. Having dysfunction in any of these parts of the pop can cause issues in any of your joints. And so if you are sitting there and you have back pain or hip pain, and you didn't realize that could be connected to the pelvic floor, it's absolutely can be connected and you should get it checked out. So if I pop the top to my soda can, which I'm going to take a sip of because I'm thirsty, you will see that all of a sudden the walls can squish in. I can squish my pop can with ease, right? As long as I dump out the fluid. And that's what it's like when you have a weak core. So a lot of times this happens during pregnancy, or if you just had a baby, your core is kind of floppy. Or if you have any scar tissue, if you had an appendectomy, so any abdominal scarring, that can affect how strong the actual soda pop can, the core, is, and can prevent you from really protecting your joints. So I'll let you sit with that for a second. Type into the chat if you have any questions on the core and like the whole core muscles that we just went through. I would love to know. Great. I will keep going here. So that is the importance of the core. Here now I will go into the issues that can be affected when you have problems with the core. So specifically, I already said hip pain, back pain, knee pain, even neck pain can be a problem with the core itself. Shoulder pain can all be connected and leads back to the core, because if we don't have this strong pop can, then we're just not absorbing the forces very well. And so the other joints will start to take up the slack and wear out almost. And that's when we'll get pain in other places in the body. So that's one issue. Those are more orthopedic issues. And a lot of times we end up seeing people that have already been to other physical therapists that just like their shoulder pain keeps coming back or their back pain keeps coming back. And it's just because they're not getting to the root cause of what's not happening in the core. So that's the first bit of issues. The second bit of issues that is a little bit easier to identify as just pelvic floor issues are a few things. So first, we're going to talk about everything related to the clitoris. So the clitoris is responsible for orgasm. So it is normal, as I drop my pelvis here, to be able to have an orgasm that feels good and is really easy for you to get, and then leaves your body with complete ease. There's no pain associated with the orgasm. It doesn't feel hard to get. There's some women that have never had an orgasm in their life. And a lot of times this has to do with issues within this first layer of muscles and the rest of the layers as well. But that can play into having problems with orgasm. So orgasm is very healthy, very natural. It's good for the core. And if you're not able to have that, or if it's painful at all, that would be a sign that your pelvic floor isn't working for you. The next thing that is important to talk about is everything that is associated with the urethra. So if you're having difficulty voiding, difficulty having peeing, so say it's like just hard for you to initiate the stream, or you feel like you have to get moving to get the stream going, then that is problems with urination. And that can be considered a couple different things, but we'll talk about urge incontinence first, and then we're going to talk about stress incontinence. So this is when you pee your pants, when you don't want to be peeing your pants, or if you get the urges and then either can't go to the bathroom, or you delay and you just leak a little bit because you can't delay that urge, even though your bladder is full. Some people feel they have urge incontinence, or will know they have urge incontinence if they're like driving home and they know they just left the zoo or wherever they were. They peed at the zoo, but now they can't even make it home to pee. They think they have to pee again, but they sit on the toilet and nothing comes out. Or, it's just a couple drops. So a healthy bladder can hold at least 10 seconds of urine in it. So if you go to the bathroom and you're sitting on the toilet, and the minute your stream starts, you start counting. We usually count in Mississippis just to make sure you get the full second. If you get 10 Mississippis, then at least you know you have somewhat of a full bladder. Some people will have much more. And a healthy bladder is able to hold for 3 to 4 hours without leaking any urine. So there's other issues with leaking urine, and that could be irritation in the skin around the vagina and around the vulva. And so it's important to deal with. In our society as a whole, most people just get put on pads and medication to fix their incontinence. But we know that those are just temporary fixes and not really dealing with the root cause of the issue. And if that's the case, then we know that there's something wrong in our core, in our deep core, and you're not only having your signal be your incontinence, but you just know that your core isn't working for you as well. So it could be hurting your knees and your back and your hips. So that's how it's tied together. Does anyone follow me with that, or have any questions with that? So the symptom is incontinence, but really treating the whole entire core is what is going to heal that incontinence. There's also stress incontinence. So this is like if you're peeing your pants when you're jumping on a trampoline, or you are sneezing or coughing and you're leaking urine, you just can't hold it, or you need to wear a pad or change your pants. That's called stress incontinence, and that is really common as well. And I would say people have that even without having babies, so it's really common to have that. Yes, I would love to touch on how it relates to prolapse. So as far as that's its own diagnosis, so we'll talk about that now. So one thing that can be happening with peeing when you don't want to be, so having incontinence, it could be caused by a pelvic organ prolapse. Many people who've had babies have some descent of their pelvic organs. So that means that their uterus that sits in their body is now just sitting a little lower, or it could mean that their bladder that sits in their body is now just sitting a little lower, or it could mean that their rectum, so the backside, the stuff that comes out of here, is just, it actually bulges into the vaginal canal. So with prolapse, so if this is the vagina, if this is where my bladder is on the front side, the bladder can come into the vagina. The rectum could also come into the vagina, or you can have the uterus from the top dropping into the vagina. So those are what we call pelvic organ prolapses. And again, they're very common. In my book, I say that they're like present 80% of the time in women post childbirth. And a lot of people actually have this before childbirth. And many of the people that have pelvic organ prolapse are actually completely asymptomatic. So they have nothing wrong. But that's why truly, if you're in any age range, Well, any age range would benefit from a pelvic floor evaluation, truly wholeheartedly. But if you are in, like if you're in those childbearing years, like you're wanting to get pregnant or you're right before menopause, that is kind of like the golden ticket to get a pelvic floor exam, because you'll know, like you'll find out if you have any descent of your pelvic organs and how to fix that for you. And now when I say fix it, it might just be that it reduces your symptoms, or it might just be that you actually didn't even know you had any issues with your pelvic organs and you didn't even know that they were coming into the vagina, and now you were just told that. And so you can get a lot of preventative exercises, a lot of preventative work to help make sure that any of your exercises that you do, whether that's running, barre, yoga, whatever it is for you, CrossFit, so that you know how to protect your pelvic organs so they don't get worse. I think I'm going on a little bit of a tangent, but hopefully I'm answering your question to the prolapse. But I think a huge problem with not diagnosing prolapses, at least like a lot of providers feel um, it's very hard to tell someone they have a pelvic organ prolapse if they're not symptomatic, because they don't want people to feel bad about themselves. But in reality, with how common it is so important to be able to know if you have it, because there is so much you can prevent. And I full-heartedly believe that, like, if the 60 and 70-year-old women in this world knew that they had pelvic organ prolapses when they were in their 30s, 40s, and 50s, that they would be able to at least change and modify their activities, or at least even their breath patterns, how they breathe through different activities, which can really protect the pelvic organs and prevent worsening of the prolapse. But then you kind of get to that 80-year-old, 90-year-old place, and most everybody is at least wearing diapers or pads, or, leaking to some degree. So that's why, to me, it's so important to deal with this and kind of know about it before you go into menopause, ideally, because then you have your hormones on your side. But even postmenopausal, you can still really help support these organs so they're not getting worse, and really not, getting pushed further and further out of your body. Unfortunately, like, a lot of people just get surgeries or bladder slings to help support this. And that is one option if you've exhausted all other resources. But I would say that's like the last thing on the list, is because, there's been some negative outcomes in bladder surgeries in the past, and not everybody wants to have mesh in their body, and there's other ways to do it now. But that would be one reason to, like, really try and help it and fix it now. We'll talk a little bit about some breathing patterns in just a minute that I have on the list today. And that will help with pelvic organ any kind of organ prolapse. It's really important with any of the pelvic floor, and really to have a super solid, rock solid core. So not just pelvic floor, but entire core, that you have really good bowel function. So that means that, like, you're pooping at least every day. So constipation isn't diagnosed until you don't go like every 4 days, but at least with like a healthy bowel, you're going every single day. And that will help manage the bloat, and that will help manage diarrhea and IBS symptoms and constipation symptoms. And so, as long as you are getting really good movement and motility in your colon and pooping at least every day, that takes a lot of stress off of your pelvic floor, as you can imagine, because then it's not having to hold everything back and work against even more pressure. So that's like one of the easiest ways to, like, really work on your core, is actually to work on your colon function. And that's a lot of what we do as far as pelvic expert physical therapists. So yes. Does that make sense about the prolapse stuff? I'm going to move on here in just a second, but cool. Awesome. Good. Okay. So we talked a little bit about prolapse. Another issue that can happen with the pelvic floor is anything in relationship to sex or intercourse. So if you find yourself that you have to have sex in certain positions because it doesn't feel good in other positions, that would be a sign that says, like, hey, my pelvic floor isn't in the best shape, or there might be something wrong with my pelvic floor, so I should get some help. So If you're very picky on like the position that you actually allow insertion, so penetrative intercourse to happen, then I would say that you should check out these muscles, have an expert look at them so you know what's happening. Some people will say that they have pain with simply insertion. So even just insertion, regardless of the position, is painful or burning. And that would be a sign that your pelvic floor, something is wonky with that. And then some people just have pain with deep thrusting. We hear a lot that I can't have sex because it feels like my cervix is just getting hit all day, or something's getting hit inside of me and it just is really painful. And a lot of times that's a problem with these deeper muscles. So if you feel like your partner is hitting something inside of you, then that would be a sign again to get some help and make sure that your pelvic floor is functioning the best it can. And yes, and you want to go to someone who really has experience in treating these pelvic floor muscles, because if you don't treat this every single day, it's easy to not fully evaluate the entire system and the entire pelvic bowl. And so, and really that is done, just so you're aware, manually through the vaginal canal or through the anus. So it can be assessed both ways if you prefer one. Most people prefer to be assessed vaginally just because it's more comfortable. Cool. So I want to talk about, and then I briefly touched on bloating and incontinence. So things that can go wrong here on the anal side. You can also have fecal leakage. So you can have stool that seeps out. So that's fecal incontinence. Or you can have, if you fart when you don't want to be farting, that is called gas incontinence. And so that will be a problem back here in the back part of the pelvic floor. So if any of this stuff is happening to you or a friend, definitely have them reach out and get a consult. And then also, just a side note, any hemorrhoids or anal fissures, so that would be anything around the anus. So hemorrhoids are those little flabs of tissue that can fill with blood. You can have them on the outside or the inside. And then fissures are little slits, like paper cuts through the anus. And the fissures are not comfortable. And and neither are external hemorrhoids. So that's all stuff that a pelvic floor therapist can help with. Another part so now we're going to move on to give you some tips. So some actual tips to help you really address pelvic floor issues and to get you started on really connecting and healing to your own pelvic floor. So, all right. So pelvic floor, when you're sitting on a chair, if you can sit on a hard surface, you'll feel your sit bones. And if you can't feel your sit bones, or you can't feel your perineum or vagina, I would ask you to simply contract and see what it feels like to do a Kegel. So you're not squeezing your buttocks, but you're just gently squeezing your anus to feel that contraction. And if you feel yourself lift up from the chair, then you are doing a contraction. However, the goal is I'm only giving you that so you sense it or have some sensation down in that area. If you can't feel this at all, you can simply put your finger there and kind of right outside the vagina. You can do this above clothes, or when you're in your privacy of wherever, you can insert a finger a little ways and feel yourself contract around a finger or relax around a finger. So there's a couple ways to just do that. So you just simply insert here and try and squeeze it. And if you can feel that, great, that's your pelvic floor. If you can't, that would be another reason to get checked out. So even if you can feel it, the most important part is to be able to feel the relaxation. So the opening of the pelvic floor. So I use anus a lot because a lot of people have trouble connecting to vagina and think about like labia opening, but a lot of people can sense a lot easier your anus opening. Oh, I just got another question and I'm so sorry I skipped it. I will talk about that in just a second. Okay, so that's the move that has to happen. So we want the opening part because that's where all the power comes from. That's where the strength comes from. That is the essence of the core. We don't care so much about the contraction because everyone is walking around in a contraction. So you're gonna have your hands. I like to have it on my belly. So you can have one hand on belly and take a deep breath into belly and exhale, deep breath into belly and exhale. What you want to have happen is when you inhale, your diaphragm drops down into belly. So I inhale, the muscle that's underneath my knee, underneath my rib cage, and at the very top of my core is dropping down into my belly. When that happens, our pelvic floor is dropping down and opening towards the floor. So deep breath into belly. You should be able to have that control of your anus opening. So I like to say that you should spend 5 minutes a day here, just thinking about deep breath into core, deep breath into belly, anus opening, vagina opening. Exhale, let it go, and be able to coordinate your breath with the bottom of the core. So that is the very start of having a very dynamic, healthy pelvic floor. Does that make sense? So 5 minutes of breathing. You guys have probably heard all over everywhere that breathing is good for you. It not only is good for that dynamic movement, but it also is great because it stimulates your vagus nerve, helps kick you into more of a relaxed state, your rest and digest state, and can be calming. So cool. Makes sense? So that is one way to have a healthy pelvic floor, is just really make sure that you can connect your breath to your pelvic floor. Someone asked privately, what about vaginal farting during exercise? And so vaginal farting or queefing or vaginal noises, those are all indicative of pelvic organ prolapse. And so it's usually shifting of some organs inside the vaginal canal. And it's due to, it's not necessarily due to the prolapse itself, but what happens is air gets sucked up behind behind one of the organs. And then when you move your legs or you go into down dog, then you'll have air come out. And so that is definitely something that can be changed quickly with just changing some muscle patterns. And even, it sounds counterintuitive, but relaxing the pelvic floor and really doing a lot of work in the third layer of the pelvic floor. So when I say work, I mean like massaging some of these muscles and lengthening them, because in most people with prolapse, they're actually too tight. So what people don't know is that they think that they're just weak because they have a prolapse, but most of the time people are just so tight, and then their organs are almost getting squeezed out of their body. So that is what I find more frequently than someone having too weak of a pelvic floor. And that's why Kegels are not the answer. If you go somewhere that people just put electrodes on your body, so there's little things that can measure your contraction, that's not ideal at all. And that won't really get to the root cause of healing the muscles or really healing and allowing these organs to go back into their places. And if you have more questions on prolapse, definitely sign up for a discovery visit with us. Anyone who does a discovery visit will send you a copy of my book, and there's a whole chapter on pelvic organ prolapse as well, and really how to start treating yourself with that. I have a pelvic organ prolapse, and I definitely not only treat it every day, but I live it too. So I love talking about it, and we definitely treat it all the time here. So hopefully that helps, and I will move on here. So the next thing I was going to talk about today is just some proper bathroom mechanics. So in order to protect your pelvic floor, you have to have really good breathing patterns to help. So that's why we started with the breath, okay? But then in order to have good poops, you want to be able to breathe those poops out of your body. So we're going to talk about how to have the best poop possible. Okay, so you can hopefully see me here. I didn't clean up the room very well. Okay, so when you're in a position on the toilet, you want to be in a flexed position. So you want your body like this. So a lot of people will have a squatty potty, which brings their knees up and kind of flexes their back in that position. Or you can be leaning over. What this does is it straightens the chute for it's called your anal rectal angle. So it just allows the poop to leave your body with that much more ease. So if you're here, you lean forward and do breathing that way. And so this is the position that you want to have, that you want to have a bowel movement in. So you want to poop in. And I would teach your kids this if you have kids, but everybody should know this. So this helps protect the pelvic floor. So when you're in this position, You want to put your hands on your belly, deep breath into belly, let it go. What's happening when I do that is the diaphragm is going down into my belly and it's stimulating peristalsis, which is my colon, and helping the stool progress down through my colon to come out with more ease. So deep breath in, I say 3 breaths. So you're 1, and then 2 and 3. At the top of the 3rd breath, you want to bear down and open up your anus, just like we were practicing with the breathing, with a little bit of effort. So it's bearing down, and it's almost like you are farting, but you don't want anyone to hear you fart. So it's just the slightest of movements. And that would be how to have a healthy bowel movement. And that is what is going to be really protective for your pelvic organs. So when you go to poop safely, flex over, bend over. If you don't have a squatty potty, get in a relaxed position and breathe here. For people with pelvic organ prolapse, this might actually be different because of the positioning of your organs. First, you might have to splint. So you might have to insert a finger to hold in the vaginal canal, which would look, if this is my vagina, you could put a finger in to help you poop with more ease. And that's called splinting. Or you might have to lean backwards, and that's what feels like you can kind of get the stool out all the way. And so I would definitely say to find the position that works for you. But if you find that like the bent over isn't working, you might have prolapse and you might want to get that checked out. But again, everyone should get that checked out. So cool. Just checking questions here. Okay, great. So that is how to poop. Anyone have questions with that or want me to go over it further? Cool. All right. The next thing that we'll talk about is just activating your lower abdominal muscles. And the reason I want to just teach you that is because that's also really important as far as supporting your core. And you want to be able to do this without contracting your pelvic floor. And I say that, but it's not always true. But if you have any pelvic floor issues, you want to learn how to isolate this muscle. So what this looks like, I'm pregnant, so it's going to be a lot different on me than it will look on you, but this muscle lays under here. So if you have your hands on that muscle, you would think about it as pulling up and in and letting it go. So you shouldn't see much movement when I contract this muscle. You can think about it as pulling, as contracting your bladder up to your belly button, and that will help contract your transverse abdominis. If you feel your anus squeezing here, that means your pelvic floor is working, and we want to prevent the pelvic floor from working. So you're really trying to isolate that muscle between 2 hip bones. I like to say, if you're laying on your back or wherever, put your hands right inside your hip bones, and you want to feel like you are threading a wire between the hip bones and kind of pulling them together. Not a lot of movement happens, but you'll feel a firming that comes up and in when you're contracting this muscle correctly. A lot of people don't contract this correctly, and it ends up putting a lot more stress down through their pelvic organs. So a healthy thing to do, especially during pregnancy, is to make sure you can contract this muscle 10 seconds, 10 times. So these are just some of the tips I have. Obviously, everything is specific to your individual case and situation. And so I highly recommend that you seek an evaluation from a pelvic expert PT, and we would love to be that for you. So any questions at all, please drop it into the chat and I'll answer it. But that is what I have for you today. And my book has a lot of this information. It's called Restore Your Body After Kids, but there's a lot of pelvic floor info in the book too. So if you want just more information on the pelvic floor, we also have the Edmonds Mom's Room podcast, and feel free to hop on there. And there's a lot of different podcasts about certain issues as well. So cool. All right. Well, love to chat with you guys further, and feel free to sign up for a discovery visit. Thank you for coming, and I hope you enjoy some sunshine out there. It looks like it's still sunny in Edmonds. Oh, I'm sorry. One more question. Should breathing engage the pelvic floor or not? So I believe that breathing, I don't know what you mean by engage, But as far as like the natural state of the pelvic floor, when you inhale into belly, into rib cage, diaphragm descends, and the pelvic floor needs to follow that movement. So on the inhale, the pelvic floor opens, and on the exhale, there is some natural recoil. So on the inhale, it will open. On the exhale, it will recoil. So um, so they work together. They're very dynamic. If you're training for birth or you're pregnant and you're training to have a vaginal delivery, you want to really focus on the opening aspect of that. Anytime, if you got this lecture at all, you've found that you want to focus on the opening 100% of the time, but you might want to focus on keeping it open during the breath patterns when you are when you're training for labor, when you're doing breathing for that. I meant for the lower ab exercises. Oh, yeah. So it's a little bit higher level, but as far as like when you engage TA, you still want to be able to breathe. So you should be able to engage TA while holding that inhale and exhale. There's different training ways that you can train. You can hold it and try and breathe as much as you can. At the top of the inhale, engage even more. At the bottom of the exhale, engage in even more. And play with it that way, but you want it to be strong enough that it supports you through your breath patterns. Cool. Hopefully that makes sense. Awesome. Cool. Any other questions? We're happy to chat. I'm happy to answer. Is pushing the protrusion back into place harmful? As far as, I'm assuming that's as far as pelvic organ prolapse. No, it's not necessarily harmful, but you do want to get it looked at because you want to know what you're pushing back in. Is it your anterior wall of the vagina? Is it the front part where the bladder is? Or is your cervix coming out and you're like kind of pushing that back in? Or is it your rectum and you're pushing that back in? Or the posterior wall, that's what you're pushing back in? Or the other option is like, is it your rectum and you're like seeing it come out and you're pushing that back in? It's not necessarily harmful, but you want a professional to look at it so you know what is happening and you know what is safe as far as like helping you put things back into their places. Doing some anti-gravity positions, like being in a bridge position, can be really nice. And that can help things kind of sink back into their place. Most people with pelvic organ prolapse may initially be, some people may be scared of intercourse, but that's actually great because intercourse can be really beneficial for pelvic organ prolapse because it can help kind of put the prolapses in place, put your pelvic organs in place. So it's definitely not harmful unless it's painful. That would be harmful. So we wouldn't want to do it if it was painful. So as far as pushing your prolapses into place, that is a-okay. But you should have it looked up too. Cool. All right. Thank you guys so much for joining me today. Happy Monday.